Each week we have an in-depth conversation with one of the key players in the legislative process. This week we welcome Representative Clay Mansell, a Republican from Clinton who represents House District 56. Representative Mansell is serving in his first term in the legislature. He is vice chairman of the House Medicaid Committee. Welcome to At Issue, Representative.
Yes, thanks for having me. I'm glad to be here.
You are a freshman. You won election just this past November 2023.
Yes, sir.
So I'll start there. We've spoken to a lot of legislative veterans. You're the first new member. I'll start with what led you to seek election in a district that was previously occupied by former Speaker Philip Gunn.
Yeah, absolutely. I've gotten that question a lot. I've been heavily involved in city politics for years and years. I know politics in Hinds and Madison County, backwards and forwards. But I had not thought about running before. It wasn't on my radar. And I've told this story a lot. I was actually talking to a good friend, Ryan Tracy, one day, and we were talking about who should run because Philip had announced that he was not running.
Right.
Not an hour after I hung up the phone with Ryan, Philip calls. And I was like, oh, great. He's calling to talk about who should run. And Philip's very direct and to the point. His second sentence out of his mouth was that he had talked to his wife and that they thought I should run. So it really caught me off guard, and we had a long conversation, but kind of left it on let me pray on this and think on it over the weekend. Talked to my wife a lot and friends, and they knew how involved I was in foster care and adoption issues. So they kind of twisted my arm on that, and I talked to Philip on a Friday and then called him back on Monday and told him I was in and, asked him what the next step was. What do we do next?
Yeah, and so you come in and a number of committee assignments, including vice chair of the Medicaid committee, something that a committee that Speaker Jason White, made a lot of leadership changes too in that committee. And I mean, I have to ask your predecessor, your district predecessor, being former Speaker Philip Gunn, a very vocal opponent of Medicaid expansion. Now here you are in the committee that passed a pretty full expansion bill. And the House's policy has been a almost like a traditional expansion of Medicaid. What's that like? You're taking a leadership role as vice chair in the Medicaid committee to bring forth legislation on an issue that under the former leadership really never saw the light of day.
Yeah, absolutely. Good question. I think that for a long time they were waiting to see what the federal government would do and thinking that something would come out in the expansion role that would work for Mississippi. And I've talked to some people that have been there a while, and they kept thinking that something was coming down the pipe, Medicaid, that would suit the needs of Mississippi. And I think it's finally just became obvious that that wasn't going to happen. So that's why Jason brought forward his bill.
All right. Within that committee, I mean, as I think when the legislative session started, everyone was looking at the two Medicaid committees to see what would happen. As someone on that committee, what were those early days like? I know that Speaker White had a hand in kind of crafting that bill, but everything starts in committee. What was the process like early on?
Yeah, well, early on we took up a bill that kind of got us, I guess, all working together, and that was the presumptive eligibility.
Right.
And that was a great bill, had huge support. So any lady that's expecting a child can now go to a doctor that has signed up, and they can get her medical day one. So prenatal vitamins, everything like that. So that was kind of a great way for us to work together on a bill that just made a lot of sense. And then we had hearings. Lots of groups came in and gave us information, explained to us what the costs looked like and how the percentages worked. Because I was new, and even if you had not been on this committee, you hear them talking about 90% versus what percent?
138%, right?
Yeah. So it was a lot of numbers, and the Hilltop group came in, was one that really gave us just a lot of information, explained how it worked and different things like that. So it was a lot of educational stuff early on.
All right, and then that bill, or the issue of Medicaid is headed to conference. I don't think there's been any announcement on conferees, but what do you at least look forward to as far as the negotiations with the Senate?
I think there'll be some good negotiations because in the building there is an appetite for this. Now you have close to 170 people that you're not going to come to the same answer
Yeah.
on exactly what that looks like. I'm sure the House position will be pushing theirs and the Senate will be pushing theirs. But I think both sides of the table are interested in this. So I don't know what that's going to look like. But hopefully they come out with something that they can get the votes on.
All right. Well, I've drilled you about an issue right off the start, but I kind of want to go back and look at the freshman experience a little bit.
Absolutely.
Stepping in as a new lawmaker and the first session after an election is an extended session. It's a 120-day session. And part of that is to kind of allow new members to understand what's going on, to get some orientation, allows leadership to get the committee assignments taken care of. So what were those first few weeks like, learning the building, learning the procedures, because there's lots of new language or interesting language you have to learn when it comes to doing anything in that building.
Yes, and I don't think I know it all yet. They'll still say something, and I'll have to ask Jill for like, what was that? And another thing you get twisted on sometimes, and we just had this happen. The board lit up like a Christmas tree. We're so used to voting one way, and then on an amendment, it depends on who presented. Are we voting yes or no? So you're always kind of second guessing yourself to make sure you're doing it right. But you're learning a lot quick. I think I've gotten the basics down pat. We had a good group come in. There's about 28 freshmen, especially the ones that are around here early on through the campaign process. We were kind of traveling together, a lot of the same events. So I've made some really good friends that are in our class. And even the ones that aren't local, we've all kind of gotten together. We actually started the freshman caucus, and we go out to eat about once a week. I think we've got 2 or 3 more of those planned. So we're getting to know each other. Sharing stories, what we've learned. We've got a text group too. When we don't know what we're doing, we can text and say, "Where's this meeting? Who's going where?"
Ask each other first before you ask someone else.
Absolutely.
And so, anyone who kind of follows the legislative process knows that there are moments in that first session where freshman representatives will get up and present a bill. It might not be one that they wrote, but they'll get up, present a bill to kind of go through the procedure. So what was your bill presentation initiation like?
Well, my first one was pretty easy. I just had to present a repealer, so that was easy. But others had, I guess they drew the short straw. Like Jimmy Fondren had to present a bill on allowing pink as a vest color for hunter safety. And Celeste Hirsch had one about sidearms that took some interesting turns. Mm-hmm. So there were some fun ones that got presented.
Now that this session's almost over, and you've gotten kind of all of this in the rearview mirror. I mean, we're only got a few weeks left before sine die, if it doesn't end any earlier than that. What have you taken away from this session that you think will help you in future sessions?
Well, just the networking and getting to know people. I've had some great chairmen that have really helped me, let me present a lot of bills. Kevin Ford, Lee Yancey, several of them have really let me present a good number of bills on the floor, which has helped. And then learning how to move my agenda. Before we went live, we talked a little bit about foster care and adoption,
right, yeah.
Which is one of the reasons I ran. But really, I've learned, we've had such a huge session on job creation and the economic development projects. It's amazing to see how job creation solves just about every problem we have. So that'll probably be my new go-to, is let's talk about jobs, because that even helps my foster care issue. If you can give somebody a career, and it's a lot harder than just saying that. You've got to get them to be willing to accept the job. But if the jobs are there, you can give them a career, they're less likely to have CPS invited into their home for any reason. It just solves a lot of problems. So it was neat to me to see the different things that affect the state and how they affect the state.
And that foster care and adoption issue, how did that come to be an important issue for you?
Well, we have had 11 children through our home. We were on the reunification side, so the first 10, they came with us and they stayed until a grandmother or the mom was able to care for them. Some as little as a long weekend and some 10 months. Other than the 11th child, we thought we were still in the reunification plan, but God had a different plan, and he just decided that we were going to adopt this one. And it worked out perfect. It was a short adoption. Everything went super easy. And I want to share that story. I try to tell people that because a lot of times you only hear the scary stuff, the hard stuff, and every story you hear is true, and there's some crazy hard adoption stories, but ours was just smooth as it could be. Everything went perfect from the time he hit our door the first day until he was adopted. It was a little less than 9 months, and a month of that was just us deciding that we were ready, because we were thinking reunification. So it takes a second to adjust to adoption. But he just turned 10 this week. His name's Bentley, so we're super excited to have him in our house.
All right. And with that issue being such a close one to you, what do you see? What parts of Mississippi system do you think could use some reform? And there are other places that Mississippi does something really well when it comes to adoption and foster care.
We do get a lot right. CPS does get a lot right. They've improved it a good bit. I've watched it improve. But I don't think, to take up for this system, I don't think it'll ever be a perfect, no matter what. If we gave them unlimited resources, it can't be perfect. When you're dealing with the issue that they're dealing with, the trauma from the children, the homes, moving from home to home, you can't get it perfect, but we can work with them to support them in any way we can, give them the resources to lower the volume of the caseworkers, and just little things. Like we just passed a bill this week, or last week now, to give them free transcripts, to give them free admittance to museums and state parks for the whole foster care family. So there's lots of, and I think they're going to tweak that bill in conference because it was amended. But there's lots of things that we can continue to do every year. And before I got there, they did lots of great stuff. So there's huge supporters in the House and the Senate for the foster care system.
All right. And we fit on some issues that were kind of close to either. Well, if we fit on Medicaid, we fit on the adoption issue, which is one that's close to you. And anything else that I like to leave interviewees with this, with an opportunity. Anything else that is of importance, not just as this session closes out, but as your term continues over the next 3 years, that you'd like to really see the legislature take up.
Well, I'm going to continue to push economic development. Okay. I think that's going to be huge. And then one smaller thing is we introduced the Purple Alert this year. We have the Amber Alert and the Silver Alert. The Purple Alert had lots of support. I mean, it went through our committee and our floor, and it went through the Senate committee, and it's coming to the floor hopefully this week. And once that gets passed, we'll have to educate people on the different systems. We'll have to do a little bit of work on the Silver Alert, because right now a Silver Alert technically covers anybody 18 and up. And if you heard a Silver Alert, you automatically think senior citizen.
Right.
So we wrote our bill in a way that you can combine it. So you can have a Purple Amber Alert, so you immediately know if they say a 9-year-old that it's probably a 9-year-old that has a cognitive disability.
Right. And this is clear. What was the purple? A Purple Alert is meant to kind of notify regarding what community? Go and clarify that for us.
Any age with a cognitive disability.
Okay. Yeah.
And it just, in saying that one word, it communicates a lot to law enforcement that they are going to need to deal with that individual different. And a younger child, if you know anything about that community, they're usually, a lot of times they're runners. And they're not running to get away from their mama, they're just running.
Right.
There's so many stories of how quick they've gotten a mile away. So the Purple Alert, and the support that it had from that community was just huge. They drove from all over the state to come to the Capitol to talk about it, and they gave out T-shirts. I mean, it was neat to see them come together to support that cause.
And like you said, the law enforcement piece too, like you mentioned, the response is different. Is anything about that Purple Alert, at least when looking forward and building on that, to get more, maybe mental health professionals or caseworkers involved in something like that rather than law enforcement?
Yes, I've had those conversations already. So it's opened up a lot of things. Talking about what I'll work on going forward is things that we can do to support our law enforcement and bring in the right people when they're dealing with a case that would need a social worker over a police officer.
Okay. All right. And last question. As a freshman nearing the end of the first session, what has surprised you most about the legislative process?
Well, really all of it. You always hear people say, and I hear this about retail all the time, you just need to work retail to understand it. I don't think you understand it unless you're in that building, unless you're a lobbyist or you just really follow it closely. So the entire process has been interesting and a big learning curve.
All right. Well, Representative Clay Mansell, thank you so much for joining us on At Issue.
Absolutely. Glad to be here.
For an extended version of my interview with Representative Clay Mansell, please subscribe to our At Issue podcast.